All right, so fraud warning number 2. I want to make sure that you do understand that there is this thing called a treatment plan. A treatment plan, I know you know what that is, but a treatment plan does include a short-term set of goals and a long-term set of goals. In the short term, you're saying what you think you're going to accomplish in the next week to 4 weeks. And really you want to focus as early as possible as a short-term goal. And then you want to also put down your long-term goals, what you hope to expect in 4 weeks or more. And the point that you really need to make is that every time you do re-exam, which should be a minimum of every 10 to 12 visits, or 30 days at the most, is that you then look at your short-term and long-term goals and you rewrite those. You set up new goals. You set up new short-term goals and new long-term goals. You should also find that your diagnoses have changed. They're not the same diagnoses. Hopefully, if you pick 4 or 5 diagnoses in the first day or 2 of care, some of those have already alleviated, and so that you would have less diagnoses than you started with. You should show that those are going away. You should also make sure that when you do your treatment plan, that there is a clear and concise support for the modalities that you're using to match up with those goals. So in other words, you not only list your goals, but when you list the treatment plan and those things that you're going to do, you give the rationale that are in your goals beside those things that you're doing. So you may have like reduced muscle spasm. Well, what are some of the things that you have on your treatment plan that match up with reducing muscle spasm? Put that beside each one of those modalities that applies to. You might have get rid of pain. Well, put down get rid of pain beside each one of the modalities that apply to that one. You might have to increase range of motion. Well, which things help with that? And so make sure that you not only put down your goals, but you match up the goals with those treatments that you're doing. If you do this, it will help you to win any type of audits you go through with insurance companies, and we feel that's important, and so should you.